some of the misinformation out there is that you'll grow out of ADHD. And sometimes someone might grow out of ADHD, well, then it truly probably wasn't ADHD. Maybe they weren't accommodated for another physical or mental health conditions, but they're very strong linkages that it'll carry through in adulthood. And so white Caucasian boys are most commonly diagnosed, but women in all gender expressions experience ADHD as well. I see a lot of women in their 30s, 40s, 50s, and 60s that either have a misdiagnosis with something else that actually is ADHD. And because I am trauma informed, sometimes it is because of trauma and it looks like ADHD, or they've never been diagnosed in the first place. And so some of the assessments too aren't culturally competent. They're not trauma informed. They're not geared towards, so ADHD has a strong linkage with autism. And so many of those assessments are more geared toward males versus females. And so that's kind of the problem with the assessment. And then another issue is just access to assessment. In our community, we only have a couple providers. They're not trauma informed. People have to wait a long time to get in. And it's not culturally competent, the assessment criteria. And so there are huge pieces of data out there that show that Black children are actually misdiagnosed and more likely diagnosed with a conduct disorder. And so they're more likely penalized for having ADHD symptoms. And so there's actually many Black Americans that haven't been diagnosed with ADHD, and they were missed along the process.